Good afternoon, and thank you everyone for attending today's webinar, Answering Questions About Telemedicine in New Jersey, presented by Grace Mack and Michael Schaff of Wilentz, Goldsman & Spitzer. Please be aware that there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the question box located on the right of your screen. They will be answered in the order received during this portion. Again, NJMGMA would like to thank you for attending, and I will now turn things over to Michael.
Thank you, Dawn. First of all, I'd like to apologize in advance. I have a fairly bad cold, so maybe you're happy about this, but my partner Grace will probably do most of the slides, and if I break into a coughing fit, I apologize in advance. In any event, today's seminar is going to be on answering questions about telemedicine in New Jersey. Our agenda is very large. We're going to talk about a description of telemedicine. We're going to talk about some key terms in telemedicine and telehealth, how telemedicine is being used, opportunities for telemedicine, some barriers to telemedicine, some public and private payer reimbursement issues, state telemedicine law developments, not only New Jersey, but some of the other states. We're going to go through some OIG advisory opinions, not too much because we know you're not lawyers and we don't want you to fall asleep. We're going to talk about licensure and telemedicine, telemedicine privacy and security. We're going to go through some recent developments. We're going to talk about telehealth projections into the future, and then we're going to have a quiz. We're going to try to test your knowledge, and then we're going to open it up to some questions and answers. Now, when I was in my youth, I used to watch TV a lot, unlike probably all of you, but one of the things that, thinking back on my youth, is some of the shows that dealt with things that projected into the future. And two of them in particular, one is Star Trek, where you had Dr. McCoy, or people would call Bones, who would be able to wave things in front of you and diagnose you, okay? We're almost there. Another one of my favorites is the Jetsons. And what we figured we'd do is share this clip with you as to how they saw these things back in the early 60s.
School. I don't feel good, Mom. I think I'm coming down with Venus virus.
Venus virus, eh? Last week you said it was Martian mumps. Anything to miss the space calculus test.
I tell you, I'm sick. Oh, this is it. It's growing black. Quick, where's a pencil? I've got to make up my will.
All right, hold on. Just hold on. I'll call the doctor. Calling Dr. Racy. Dr. Ken Racy.
Yes, Mrs. Jensen, somebody got a pain in the tummy tum-tum?
It's Elroy, Doctor. I think it's the Venus virus this time.
Venus virus? Oh, that can be catching. All righty, Elroy. This is your dedicated physician speaking. Stick out your tongue. Oh, my.
Well, what do you see, Doctor?
2 dozen gumdrops, a pastrami sandwich, half a pizza.
Elroy, for breakfast?
Well, you see, I thought it was my last day on Earth.
Yes. Well, it pains me to tell you, but there's only one known cure.
What's that?
A full day at school. You're fine.
Oh, phooey.
Elroy. Thank you, Dr. Racy. Sorry to call you needlessly.
Think nothing of it, madam. It's my duty as the nation's #1 dedicated physician. Which reminds me, one house call, the usual fee. No hurry on the bill. Tomorrow morning will be fine. Happy medicine.
Well, Elroy, you just spent your father's raise.
Gee, I'm sorry, Mom.
So it's really interesting that back in the early 1960s, they predicted that a 1-minute doctor visit in the future would be $100, and the payment would be the next day. I guess a lot of doctors today who practice telemedicine would be happy to get that $100, and they'd love to get it the next day.
In case the Jetsons cartoon didn't cover everything, we thought it would be helpful to answer questions about telemedicine using our version of the method that journalists use to cover a subject. They say that you can learn about any subject by answering the 5 W's and an H. Those are who, what, where, when, why, and how. The first question that we're going to answer about telemedicine is, what is telemedicine? What is telemedicine? It really depends on who you ask. The Medicare definition of telemedicine is two-way, real-time, interactive communication between the patient and a distant site physician or practitioner, but it is not communication via telephone, email, or fax. What is telemedicine under New Jersey law? Well, New Jersey is one of only 2 states in the nation that does not have an official definition of telemedicine or telehealth. New Jersey has proposed some laws defining telemedicine, neither of which have yet been enacted. So we'll keep an eye on those, but in New Jersey there is no enacted law defining telemedicine. Proposed law S2729, which was introduced on February 2nd of 2015, defines telemedicine as the delivery of healthcare using secure two-way video conferencing designed to replicate the traditional healthcare by allowing for interactive, real-time visual and auditory communication and the electronic transmission of images, diagnostics, and medical records.
Now, you all got that? You all understand that? We'll go to some other states.
New York has a law which defines telemedicine, and that was effective as of January 15th, 2015. And that defines telemedicine as the delivery of healthcare through real-time two-way electronic audiovisual communications, including the application of secure video conferencing or store and forward technology to provide or support the delivery of healthcare, slightly different from the Medicare definition. New York, in addition to a definition of telemedicine, they also have a definition of telehealth, which includes more things than telemedicine. That's the delivery of healthcare by means of information and communication technologies consisting of telephone, remote patient monitoring devices, or other electronic means. So telehealth covers more than telemedicine. The Federation of State Medical Boards, which is a group of the medical boards that adopt certain standards and model policies that states may or may not adopt. So the Federation of State Medical Boards has a definition of telemedicine, which some of the states consider and adopt, and that defines it as the practice of medicine using electronic communications, information technology, or other means of interaction between a licensee in one location and a patient in another location, with or without an intervening healthcare provider.
Keep in mind we're going to have a quiz afterwards, so take some notes.
And then the American Telemedicine Association has yet another definition of telemedicine, which is the use of medical information exchanged from one site to another via electronic communications to improve a patient's clinical health status. Telemedicine includes a growing variety of applications and services using two-way video, email, smartphones, wireless tools, and other forms of telecommunication technology. So
are you confused yet?
So what is telemedicine really depends on who you're asking. What telemedicine isn't? Telemedicine is not audio only, telephone conversation, email, instant messaging, conversation, or fax. Another important thing to keep in mind when you're learning about telemedicine is what are the key telemedicine terms. The first term is the distant site. And the distant site is the location where the distant site practitioner is located. For example, in the Jetsons cartoon, Dr. Racely's office would be considered the distant site. The originating site is the location of the patient at the time the service is furnished. That would be the Jetsons' home, would be considered the originating site. The remote provider or the distant site provider is the provider who provides the service via telemedicine who is not at the same location as the patient. That would be Dr. Racely. Store and forward is a type of telemedicine, which is the transfer of data from one site to another through the use of a camera, but it is not sent simultaneously via telecommunication. So the Jetsons example is in real time, so that's not an example of store and forward. The telepresenter or the provider extender would be a provider or support personnel at the originating site who assists the remote provider. An example of this would be if a nurse practitioner or a physician's assistant was at the Jetson's house and interacted with Dr. Racely while he was at the distance site. The next question having to do with medicine would be where. Where does telemedicine take place? Generally, the practice of medicine occurs where the patient is located at the time the telemedicine technologies are used. In our Jetsons example, it would take place at the Jetsons place of where they are located. So as a result, the physician should be licensed by or under the jurisdiction of the medical board where the patient is located, unless an exception applies. So in this case, would Dr. Racely have to be licensed in where the Jetsons are, on their planet, on their state? That's a lot of the telemedicine questions of today. Where does the physician have to be licensed? And physicians who treat or prescribe through online services are practicing medicine and must possess appropriate licensures in all jurisdictions where the patients receive care, unless an exception applies. So some states have exceptions for consultation, for second opinions. Some states have special telemedicine licensure requirements. Some have simplified license application processes for out-of-state physicians. In New Jersey, if NJS 2729 were passed, as I explained before, it's only proposed, it would allow out-of-state practitioners to provide telemedicine to patients in New Jersey pursuant to a reciprocal medical practice license. Medicare, in addition to requiring the physician at the remote site to be licensed, Medicare also requires a telepresenter to be physically present with the Medicare beneficiary if it is medically necessary for the telemedicine service. And that's determined by the distance site physician. The process to obtain licensure varies from state to state and is dictated by each state's Medical Practice Act. A medical license might take 2 or more months to obtain from the initial application to the grant of the license, and state licensing fees range from between $200 and $1,000 or more. Additionally, when applying for a medical license, you must submit information that may affect their ability to practice, such as health status, malpractice actions, settlements, and criminal convictions. The Federation of State Medical Boards, the organization of medical boards that we talked about before, has proposed an interstate medical licensure compact. So states that sign on to it agree to be bound by this compact. Many states are considering it at this time, and under this system, participating state medical boards would retain their licensing and disciplinary authority, but would agree to share information and processes essential to the licensing and regulation of physicians who practice across state borders. Participation in the compact would be voluntary for both states and physicians. As of October of this year, 11 states have signed the medical licensure compact. They're there on the slideshow. I won't go through them. You can see notably missing is New Jersey. And also as of October, it is also pending in another 8 states. Again, New Jersey's not listed. So there are 19 states that have either agreed to the interstate compact or it's pending to be approved. An interesting case involving licensure and telemedicine is the Teledoc case and the Texas Medical Board. In April of this year, the Texas Medical Board adopted regulations that said that the physician-patient relationship had to be through a face-to-face encounter. This went against the Teledoc methodology of even the way they practiced. So Teledoc sued and brought a case trying to stay the implementation of the rule. So the court in May 29th, 2015, passed an order granting a preliminary injunction. So they prohibited that law from going into effect while the case goes through the system.
Which means basically that in Texas, even though there's a law that says it needs to be face-to-face, it's not being enforced, so you can still do it over the internet.
The next question is who? Who may practice telemedicine?
I think it's a plumber. What do you think, guys?
In New Jersey, under the proposed law, if it were enacted, Physicians can practice telemedicine, but it also allows nurse practitioners, psychologists, psychiatrists, psychoanalysts, licensed clinical workers, physician's assistants, and any other healthcare professional acting within the scope of a valid New Jersey license or certification. Medicare also has practitioners in addition to physicians who may practice telemedicine.
Right. Keep in mind that a lot of patients, are Medicare beneficiaries, and one of the important things for your practices is that you get paid. So you need to make sure you comply with those rules and regulations if you're going to plan on doing that.
And Medicare has a lot of, we'll get to that when we talk about reimbursement, but they have a lot of strings attached to the practice of telemedicine. But Medicare does allow, if you qualify under all the other provisions, physicians, nurse practitioners, physician's assistants, nurse midwives, clinical nurse specialists, clinical psychologists, clinical social workers, and registered dietitian or nutrition professionals. Internet pharmacies is another area on who and where you can practice that has been really interesting, and a lot of issues arising out of it. There was a case in 2007, Haggesef versus Superior Court in California, that really brought the issue of where the physician has to be licensed to the forefront. There was a Stanford student who was in California, and he obtained a prescription for Prozac from a doctor in Colorado after completing an internet questionnaire.
It was 2 questions. Number 1, what's your insurance? Number 2 is, do you want Prozac?
So the student died of a drug overdose shortly thereafter, and then the lawsuits began. In that case, the court held that California could prosecute the physician for the unlicensed practice of medicine in California because he had reached into California through telemedicine, thereby invoking the California medical licensing laws. New Jersey, if enacted, again, the proposed law says a physician may issue a prescription after engaging in a face-to-face examination of the patient, either directly through traditional in-person means or methods, or remotely through the use of telemedicine. So it'll be interesting to see what ends up getting enacted in New Jersey. The next question is how. How should telemedicine be provided? I'm going back again to the Federation of State Medical Boards because that gives us guidance, since we don't have anything specific in New Jersey on that. But they give a lot of guidance of the way they feel would be a good way to do it. So they said, their policy says that a physician should not render medical services using telemedicine without fully verifying and authenticating the location, and to the extent possible, identifying the requesting patient. So the telemedicine encounter should have these components built into it so you can protect yourself with following really the standard of practice. The next component that the Federation of State Medical Boards includes is disclosing and validating the provider's identity and applicable credentials. So that should also be some part of the telemedicine encounter, whether it's on the video conferencing, whether it's forms that are signed, but these components, the practice should be try to really hit as many of them as possible. Should obtain appropriate consents from the requesting patient after disclosures regarding the delivery methods and treatment models and limitations, including a special informed consent regarding the use of telemedicine technologies. So if you're doing telemedicine, your consent form should really have a separate section on telemedicine and the risks of telemedicine and the alternatives.
So if you're going to do that, you need to revise your forms to incorporate those.
And the informed consent should include identification of the patient, the physician, and the credentials. So in the informed consent, and if possible, even in the telemedicine encounter itself, whether Dr. Racely in the Jetsons example would have a form that he would have given to the Jetsons, or on the encounter itself, certain representations could be made. The informed consent should include the types of transmissions permitted using telemedicine technologies, prescription refills, appointment scheduling, patient education, those type of things. The patient should agree that the telemedicine is appropriate. The potential privacy risks should be disclosed. There should be a hold harmless clause for information lost due to technical failures. And there should be a requirement for express patient consent to forward patient identifiable information to a third party. So a lot of times with telemedicine encounters, information may be exchanged between members of the network of the telemedicine encounter. So really have to be careful to make sure that patient consent is obtained.
You don't want a HIPAA violation there.
And how should telemedicine be provided? How should the evaluation and treatment should be done? Things should really be done using the same standards that would be used for a traditional encounter. Certainly treatment should not be based on an online questionnaire only. There should be continuity. The encounter should really tell the patient how to seek follow-up care, or it certainly should say if there's an emergency, what should be done. I am a little ahead of myself. The next slide shows there should be an emergency plan. An emergency plan should be provided to the patient so that if he needs to go to an ER or something should come up during the patient encounter. Privacy and security. Before patients virtually connect with the doctor, the telehealth provider should guarantee the same level of privacy assumed in a physical doctor's office. So even though it's telemedicine, you have to keep the same rules in your mind that you have in a normal patient encounter. So how should telemedicine be provided from a compliance point of view? We all know that the anti-kickback statute prohibits lots of different behavior. And we have to keep in mind that this also applies to a telemedicine encounter or telemedicine, the whole telemedicine world. The anti-kickback statute is it says that there's a criminal offense to knowingly pay or solicit remuneration in exchange for referrals. So telemedicine arrangements must be reviewed for compliance with the anti-kickback statute. This includes arrangements among the providers themselves and also arrangements with the technology providers, the people who give the telemedicine equipment. You have to really look at any arrangement and make sure that it satisfies the anti-kickback statute. There are safe harbors, free electronic prescribing or technology training, free electronic health records. You have to look through those safe harbors if that's the type of encounter that we're type of arrangement we're looking at. We would look at those safe harbors. There are some OIG advisory opinions that deal with telemedicine and telemedicine arrangements with companies. They give us some guidance. There's advisory opinion 9818, and that involved an ophthalmologist who leased telemedicine equipment to an optometrist and provided free telemedicine consultations for the optometrist patients. The optometrist could also use that equipment to provide services to patients independent of the telemedicine consultations. The OIG reviewed the arrangement and said although there were anti-kickback concerns, they felt that it did not implicate the anti-kickback statute. This was based on several factors, one being that the lease of the equipment complied with the equipment lease safe harbor requirements. Another important factor that the OIG considered was that the patients referred for ophthalmology services after the free telemedicine consultation were allowed to choose any ophthalmologist to provide their recommended services. They did not have to use the ophthalmologist who provided the free consultation. In addition, the OIG felt that the ophthalmologist's free telemedicine consultation only resulted in a minimal and incidental benefit to the optometrist. Another advisory opinion that dealt with telemedicine is Advisory Opinion 1112, which was decided in 2012. And in that case, a nonprofit health system wanted to provide neuro-emergency clinical protocols, technological devices, and services to various community hospitals in order to facilitate immediate consultation with stroke neurologists through telemedicine. Again, on its face, it's a violation of the anti-kickback statute. But the OIG permitted the arrangement based on several factors. One was that the objective of the arrangement was to reduce the number of transfers of stroke victims. Another was that the volume or value of the hospital's previous or anticipated referrals would not be a condition of participation in the telemedicine project. There's a typo there, so when we give you the presentation, we'll make sure it says not under that bullet. And the next factor that the OIG considers was that it really improved health outcomes. So this shows you that the OIG will consider the objectives of telemedicine and not just find it to be an automatic anti-kickback statute if it's analyzed under the circumstances. So of course you would have to, for certainty, you would have to obtain an advisory opinion, but it shows that really the OIG is considering telemedicine and realizing that it doesn't fit within our current structure, and they'll analyze it based on the circumstances. But we also have to be concerned with the Stark Law, which prohibits physicians from referring Medicare beneficiaries for designated health services to an entity in which the physician has a financial interest. Telemedicine arrangements that involve free equipment or volume discounts should be analyzed for self-referrals and self-referral exceptions. And as you know, we're here in New Jersey. In addition to the Stark Law, you also have to be concerned with the Cody Law. So any arrangement that involves a designated health service, even if through telemedicine, you have to analyze it under the Stark Law. So we always have to keep in mind the Stark and the Cody Law and the anti-kickback statute when we're structuring these telemedicine arrangements.
More stuff to confuse you guys by.
The next question of our who, what, where, when, and how is telemedicine being used? A number of medical specialties, such as dermatology, behavioral health, and others, use telemedicine to improve and coordinate patient care. It's also a good way to allow homebound patients to receive care in the home setting, the Jetsons example. It's used to facilitate the provision of mental health consultations to patients with access to care issues. It's also used to improve the provision of health care in rural areas and also to reduce health care costs by providing remote monitoring technologies for patients with chronic conditions. The next question, which is our variation of the who, what, where, and when, is the how much. How much are providers paid for telemedicine?
And from your perspective, I know your employers are very concerned about this one.
Medicare reimbursement, Medicare does reimburse for certain telemedicine encounters, and they will reimburse the physician at the distance site, and qualifying originating sites may also bill a facility fee related to the telemedicine. Under Medicare, telemedicine services are only reimbursable to the distance site practitioner if the services were provided to a Medicare beneficiary who is at an acceptable originating site, and that's where it gets complicated. Under most circumstances, in order to get paid, an originating site must be located in a rural health profession storage area or outside of a metropolitan statistical area. So if the Jetsons wanted to use Medicare, they would have to be located in a rural health profession shortage area or outside a metropolitan statistical area.
Which they probably are not.
And also in New Jersey, that's a very difficult. I tried to look it up before. There were some prison areas that qualify. It's a tough one here in New Jersey. But under the next generation ACO model, which was announced on March 10th, 2015, CMS will waive under certain circumstances for qualified next generation ACOs the requirement that beneficiaries be located in a rural area and at a specified type of originating site.
So that gives the ability to be reimbursed a little easier if you're part of one of those ACOs.
Medicare, and they also have, in addition to the qualifying site, it also they have other site requirements, and it must be at a practitioner's office, at an inpatient or outpatient hospital, critical care hospital, a rural health clinic, a federally qualified health center, renal dialysis center, skilled nursing facility, community mental health center. So those are the Medicare site requirements, which, if there's no in-home, it has to be at one of those sites, and one of those sites also has to qualify as the originating site shortage area or metropolitan statistical area. But if you do qualify, Medicare reimburses for various types of services: consultations, office outpatient visits, individual psychotherapy, pharmacological management, psychiatric diagnostic interview examinations, and end-stage renal disease services. And how much would Medicare reimburse? Well, Medicare would reimburse the same amount that they would have paid if the service had not been provided via telecommunications. Commercial payers really varies. It varies state by state. It varies payer by payer. You really have to determine that on a patient-by-patient, plan-by-plan basis. Some states have adopted what are called parity laws. And if the state has a parity law, it generally will cover services for telemedicine consistent with the coverage for the same service if it were not provided by telemedicine. New York has such a law, the one that was passed earlier this year. New Jersey does not have a law yet. The proposal 2729 does provide for the same reimbursement as long as the use of telemedicine was not medically contraindicated. Of course, that's not the law yet in New Jersey. The next question is why? Why should providers consider telemedicine? Well, I know we've all heard of the triple aim, which is the objectives of national health reform, but they apply here. It's increased access, improved health outcomes, and reduced cost. An example, a neurologist diagnoses a stroke patient in a distant site via telemedicine. Assume the nearest neurologist is 500 miles away. It would take hours to transport a stroke victim that far, which means that the medication could not be administered on arrival. But with telemedicine, the patient can be seen by a neurologist in a matter of minutes. Transport costs drop dramatically. There's increased access, improved outcome, and reduced costs. Another reason why providers should consider telemedicine is consumer satisfaction. A 2015 consumer survey indicated that most consumers favor telemedicine, especially those in the 18 to 44-year-old. In fact, 11% of young adults between 18 to 34 even said that they would switch doctors to get video access.
Yeah, they think it's a game.
And then, on the flip side, why should providers not consider telemedicine? Telemedicine is new. There are risks. The malpractice and liability concerns of telemedicine are an issue. You should check your policy to ensure that it covers telemedicine malpractice. There's also standard of care issues. Medical malpractice is a deviation from the accepted standard of practice in the medical community. Questions remain as to the standards of practice for telemedicine. It's an evolving area. There's also risks of faulty technology. There's risks of joint and several liability. If you're having a telemedicine encounter with another provider, do you have liability for something the other provider on the network did? These are all questions to keep in mind. There's also questions of patient abandonment. You see them in a telemedicine encounter. Do you follow up? What is the the protocol for that? There are also increased security issues due to the use of telemedicine. The next question, our version, what's the future?
Or WTF.
What is the future of telemedicine? Well, I think we all have to agree that telemedicine is here to stay. The Affordable Care Act fosters telemedicine and telehealth modalities for healthcare delivery. In fact, telemedicine and remote electronic modalities for the delivery of healthcare are mentioned more than 12 times in the Act. Michael counted them. The preamble to the final ACO rules note that the use of telemedicine is one of the key tools ACOs could employ to meet the ACO application and participation requirements. So certainly under the Affordable Care Act, telemedicine is not going away, and it's seen by the government as a key tool.
Okay, so we're going to ask a bunch of questions. Our quiz is going to start now, okay? And the first question that we have, we want to make sure you're paying attention. By the way, as you hear it, we've bugged every single one of you. So we're going to hear what you say, and if you don't say something, okay, your seats are going to start to shock you. So let's figure out who remembers what we talked about. First one is, how does Medicare define telemedicine? Is it audio-only telephone conversation? Is it email? Is it facsimile? Or is it a two-way, real-time, interactive communication between the patient and a distant site physician or practitioner? Dun, 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 beep. The answer is D. Now, how many of you got that right? Our next question is, in New Jersey, how do we define telemedicine? Is it a two-way, real-time, interactive communication between the patient and the distant site physician or practitioner, but not communication via telephone, email, or fax? Is it the practice of medicine using electronic communications, information technology, or other means of interaction between a licensee in one location and a patient in another location with or without an intervening healthcare provider? Is it both of the above, or is it none of the above? Well, if you were paying attention, you'd realize that New Jersey is only one of 2 states in the nation that does not have an official definition of telemedicine. Thought that was a tricky question, huh? The next question that we have is, where does telemedicine occur? Does it occur in the location of the physician, where the patient is located, the state where the physician is located, or where the physician's office is located? Well, it happens where the patient is located. Next quiz question. How many states have signed the FSMB Interstate License Compact? Is it all 50 plus the District of Columbia? None. How about, as of now, 11? Or is it 22? If you were paying attention, you'd remember that it was 11. Who may practice telemedicine? A physician? How about B, a nurse practitioner? What about a licensed social worker? Or D, a psychiatrist? Or E, a psychologist? Or F, all of the above? Well, the answer is all of the above. Now, why should providers consider telemedicine? A, increase access and quality of care. B, improved health outcomes. C, reduce costs. D, the triple aim, all of the above. Or E, they want to make money. And the answer is the triple aim, all of the above, but knowing some of your employers, it may be E. What do the Medicare reimbursement rules look like? Well, they're higher than traditional practice of medicine, that's A. B is the same as traditional practice of medicine, or C, lower than traditional practice of medicine. Well, it's the same, okay? So that's B. Now, with that, we're going to open it up to questions, and we'll send it back over, to Dawn and see if anyone has any questions for us.
Thank you. We only got a few questions today. Our first one is, do you know the second or other state without a definition?
No. We can find out for you.
Okay. The next question is, I'm a PCP. I want to be able to conduct ADHD follow-ups with my college kids. Can I do that?
The question is, as a primary care physician, you want to be able to do follow-ups via telemedicine or via the internet with your patients, I guess students, and this is happening in New Jersey, I would assume.
And the first encounter was face-to-face? Oh,
assume the first encounter was face-to-face. Can you do follow-up care with it? And the answer is it depends. Do you want to be reimbursed for it? You may not be able to be reimbursed in New Jersey for it. But there's nothing inappropriate for providing these types of services, but you won't be able to pay.
And assuming you follow all the protocols of informed consent and privacy,
etc. You also have to look at what the payers' rules and regulations are with respect to it. If it's Medicare, Medicaid issues, it's a little more restricted, as we indicated previously, with respect to New Jersey.
Okay. Just because there is no definition does not mean we still can't do it, correct?
That is correct. It deals with reimbursement is the issue.
Okay.
Are we answering quick enough for you?
Yes. What skilled facilities in New Jersey have telemedicine?
I didn't get the question. Does skilled nursing facilities, or is that a state?
What skilled facilities in New Jersey have telemedicine?
Which ones? We would have to get back on that one.
Yeah, we don't know the extent of it with respect to any
Particular names.
Yeah, any particular names, if that's the question.
Okay. How would that impact writing prescriptions for controlled meds for the ADHD question?
Well, I guess the question is, what is the rules with respect to providing controlled medications in New Jersey by doing things through telemedicine?
And I think the law now says there must be a face-to-face, but there's not a definition of what a face-to-face means. In the proposed law, it says a face-to-face includes, by video conferencing, but right now it says a face-to-face encounter, and it's
our opinion on that is that with respect to controlled substances, you should not be doing that via the telephone or via video conference room, etc. You need to actually see the patient and treat the patient.
Next generation ACO model allow a physician in a metropolitan area such as Manhattan to provide telemedicine.
I think we said that, right?
Yes, that is correct.
Okay.
If that's a question.
And if they're in a next generation
right.
ACO.
It has to be not in any ACO. It's a next generation ACO, which came out in March of this year.
And the actual specifics are, I believe, certainly worked out.
Okay. Are there any payers in New Jersey that approve the use of telemedicine from experience?
I think the payers are adopting it depending upon certain arrangements and protocols. The payers aren't really adopting it at this point. I think pretty much all of them to some degree, depending upon what arrangement they have with the particular provider. Still slow to come, obviously.
But what you need to do is you need to check your own, anything that you're a participating provider in, and make sure that those payers are, what their rules and regulations are.
Or I think they're setting up new arrangements with providers at this point.
Can the use of telemedicine be on self-pay basis, not go through insurance?
I guess the question is, can a patient self-pay if they would like to self-pay? And the reality is it depends on the plan that they're involved with and whether or not the services are included or not. If they're not services that are covered services, a beneficiary can pay for whatever they would like.
But if the provider is a participating provider, then they
unless it's a participating provider for covered services. You have to look at the underlying contract.
What does the physician need to do to be a part of the next generation ACO?
They need to join one.
They need to join one.
They need to locate a next generation ACO and see if they're participating in it, and then they would need to be a participating or a member of that ACO.
Is it expected that telemedicine will increase my malpractice rate?
That's a really good question.
It could also decrease it. It just really depends.
Yeah,
We'd rather see what's going to happen with that.
Correct. It really depends on what they're going to be doing and to the extent of it. It is very possible that it could have an effect both ways, depending on the provider.
And that's a very interesting question. We'll actually talk to some of the malpractice providers that we know,
yes.
and really see what their view is on that.
Are there any approved codes for billing telemedicine?
Well, are you talking about Medicare or I don't know I know with respect to Medicare, you can bill some things, so there are codes available for it. As it pertains to the specific payers, it's on a case-by-case basis.
What is the typical telemedicine fee for a consult in New Jersey?
Typical what?
The typical fee for a telemedicine consult, I honestly don't know.
The same as
it would be the same as a regular encounter. Okay.
Or some of the national companies that are coming in, they have a per visit charge.
Right. We represent a number of these telemedicine companies that are doing it in New York and some other local states, and they have different types of, fees associated with it.
Okay. Is there a link to find out what next generation ACO are in my area? Where can I join?
We can certainly find out if there is, and when we
can provide a
and
copy
we'll put that when we
yeah, well, we if people have questions and they about this, or they want a copy of our presentations, you can email us, and things like that we will be able to provide. It's either, this is Michael, it's at mshaff, H-A-F-F, at Willentz, WILENTZ.com. For Grace Mack is gmack, M-A-C-K, at Willentz, WILENTZ.com.
Can you prescribe any medications in a telemedicine visit in New Jersey?
Can I personally? No, I'm not a physician, and I don't have a license. But can you prescribe things in it? I would
It's
think,
really that face-to-face encounter issue. What is a face-to-face encounter?
Yeah, and I think it's a matter of the physicians. Any type of controlled substance, the answer to that is no. But just like if you speak with a patient over the telephone today and they have a cold, there's no prohibition.
Well, I think you have to have had there's
they must be an
specific
existing
requirements
patient
on it. I would be very careful and make sure that.
But it would be no different than if you did it over the telephone.
For now.
Are you attending MGMA 15?
Can you repeat that?
Are you attending, I guess, the conference?
Yes.
Okay.
If you buy me a drink, I'm available.
When does the parity law get voted on?
I think I looked it up. It's really kind of stalled right now.
Right. What it's done, it floats around until someone has an impetus, and right now it's kind of in committee and nothing's going on.
I don't see the one that's there now happening. There's another one, but yeah, I don't see it happening tomorrow. But I can certainly also, when we send out the updated.
Yeah, we can check on the status.
Yeah, we can check on that as well.
Will PIP carriers reimburse for phone and/or telemed consults?
Will PIP carriers, it depends on the carrier, so, and on whatever the plans are. So we don't know the specific answer to that question. They may.
Okay. And that was our last question. If anyone else has any more questions, you can type them in the question box.
Right. Keep in mind that this is an evolving area of the law. Okay, especially in New Jersey, because there's no real definition of telemedicine. But, at the end of the day, you just need to monitor it, be aware of what's going on. There's great opportunity in the future for this, okay? And, I've been at demonstrations for some of my clients where, and been given presentations on this, and you have a provider that is in, say, New York City with a extender, a nurse practitioner in some rural area of the country who is actually has a computer and has almost like a Skype or a FaceTime thing with stethoscopes and stuff, and taking, real-time view of what the patient's going through, and they're able to diagnose this outside. So it's a really interesting area of medicine.
Very exciting, I think, for us all to get involved in it and follow it through and see what happens with it.
But the people are doing it on the forefront of it, and they're creating names for themselves, almost like a brand name of care. So it's something that we believe that most practitioners should think about and at least monitor it if they're not going to do it in the near future.
What committee is the law stuck in?
We don't know the answer. We can check.
How can you accelerate the law passage in New Jersey?
Assume if you write, your representatives, and indicate the importance of it. And I would assume organizations throughout the state have lobbying arms, and you could lobby it and get it moving.
And actually, the American Telemedicine Association has a lot of legislative efforts on a state-by-state basis.
Okay, if there are no more questions, we're going to close the webinar. Thank you all for attending. The presentation will be sent out to you in 24 hours.
Thank you very much.
Thank you.